and welcome. My name is Maryanne Matthews, and I'm joined again by Dr. Zaki Ahmed, the Chief of Staff at Thunder Bay Regional Health Sciences Center and the medical specialist for our hospital's COVID-19 response. So Dr. Ahmed, the dedicated COVID-19 unit is now up and running and patients are admitted. How is that going, and how are staff and professional staff adjusting to the challenge?
Yeah, so we, as you just mentioned, so we just started doing that and on Monday, and as a result, we've started moving some patients over to the COVID unit slowly. We started off with very high criteria in terms of the risk that the patient has. So we are moving the patients that have fevers, that have that are either requiring oxygen or they have two specific signs for COVID-19, and we're starting off with that. Once we know how many patients we'll have on that, we'll start moving into having people that may or may not have COVID onto that floor, just so that we're able to keep them all in one space.
So how are professional staff and all staff working on the unit managing the challenge now that patients are in their care?
Yeah, so it's been fantastic, both from the staff, the nursing staff perspective, the professional staff. Everyone has really stepped it up, and they really are doing this from a dedicated professionalism for whether they be a nurse, housekeeper, lab tech, physician, physiotherapist. Everyone is just being superb and doing this on a very professional level, which is fantastic to see.
Yeah, that's really great to know, and hopefully comforting for the community to know that if it's needed for them, they'll be in good hands. So what does the treatment plan look for a typical patient who is admitted to the COVID-19 unit?
Yeah, so COVID-19 does not have any specific treatments that are available. So we know that despite President Trump talking about different treatments, we know as early or as late as a couple of days ago where the studies that were using hydroxychloroquine, azithromycin, have all proven to be ineffective. So there's no specific treatment for COVID-19 as we would have thought. As a result, a lot of this is supportive treatment. So we watch the person's oxygen levels, we make sure that their breathing is okay, their blood pressures are okay, and continue to support them in those areas.
Okay, and so currently we kind of touched on this earlier, but patients are admitted who are COVID-19 positive as well as presumptive cases. Is there anything being done in those situations to avoid a potentially negative COVID-19 patient from being exposed while they're admitted on that unit?
So it's really important that we make sure that the patients who do not have COVID-19 when they're admitted to this floor don't walk out with COVID-19. And that's been one of our areas of attention that we've really paid attention to and made sure that that doesn't happen. So what we've done is we want to make sure that those patients are kept in private rooms where they're not communicating with other patients. The staff that's going in is much more cognizant of the fact that they can take the disease in there, and as a result they wash their hands regularly, they change their PPE in order to make sure that the person in there who's non-negative doesn't become positive while they're in there.
Okay, so kind of following that theme, what kind of precautions are physicians such as yourself taking for when you visit the COVID-19 unit and then move on to other areas of the hospital?
Yeah, so one of the really important things to do is to make sure washing hands, right? So there's nothing better than washing hands, so whether that was on a COVID floor or not. But in specific to the COVID-19 is that we also have personal protective equipment, which we don and doff, which is terms for putting it on and taking it off. So we put on the personal protective equipment as we're walking into the unit, take care of what we need to do from a patient perspective, and then as we're leaving the unit, we take that off in the proper manner, wash our hands, and then leave the floor.
Okay, and similarly to that as well, what precautions are staff who work on that unit taking to ensure that they're not bringing potential COVID-19 virus back home to their families or anywhere throughout the community for that matter?
Yeah, so one of the things that we've done is we know that there's a high risk of doing that, and as a result, we've identified a set of scrubs for them, so when they come into work, they change into their scrubs that they're going to be wearing while they're on the floor. They go through their shift, and once they're done with their shift, they will go out, change out of their scrubs, and they may or may not take a shower, and then go home in the clothes that they came in. Once they get home, there's still a whole process of, you have to make sure that you take off your clothes away from all the other laundry, put it away, take a shower, and then you can interact with your family.
So it sounds like safety is still staying top of mind for everybody in and out of that unit.
Absolutely, right? So we want to make sure that it is a specialized unit. It's not a risky unit, and I think that's a really important thing, distinction. We want to make sure that the reason why it is a safer unit is because we have trained the staff and educated the staff in terms of how to protect themselves and their families.
Okay, great. So it sounds like everybody is prepared and doing great. Do you have anything else to add today? Any other updates to share?
No, I think the best thing, and I always end with this, is stay at home for anyone who doesn't need to be outside. And when you are outside, make sure that you have the physical distancing that we recommend, which is about 2 meters.
Okay, great. So thank you, everyone. Stay home and stay safe.